right, for those of you who are joining us by webinar, we're going to wait just a moment to make sure everyone gets logged in, and then we'll get started. Okay, so we're probably not quite a minute, but we want to take advantage of our full hour. So I want to welcome our speakers today. I want to welcome all of you joining us through the internet by webinar. So hello and welcome to this webinar on Affirmatively Furthering Fair Housing, or the AFFF rule. A little background: we know that safe and affordable and stable housing, a good home, and a community that provides good schools, fair paying jobs, access to healthy foods and green space is foundational for our well-being. However, housing inequities in this country are pervasive. Past and ongoing housing discrimination in the United States has created widespread segregation by race and by income, fostering our nation's race and income-based health inequities. As some of you are aware, on January 14th of this year, the Department of Housing and Urban Development, or HUD, formally proposed a rule change to the Federal Register that would redefine the AFFH, effectively eliminating its focus on addressing residential segregation, which we know is a fundamental cause of health inequities. In response to this proposed change, we've received questions about what this could mean from many of our partners in the health, housing, and community development space, and how to get involved in shaping this new rule. The goal of today's webinar, which is co-sponsored by the Build Healthy Places Network and the Robert Wood Johnson Foundation, is to address these questions. We'll be digging deeper into the connection between residential segregation and health, the history of the AFF rule, and what this change could mean for health equity, as well as how cities are currently using the rule and what we can do in response to the proposed change. Today's webinar is structured as a conference panel with a presentation from several experts and time for questions and answers from you, our audience members, at the end. So we look forward to a great discussion. My name is Doug Judy. I'm Executive Director of the Build Healthy Places Network. We're a national organization based in San Francisco. Our mission is to shift the way organizations work across the health, community development, and finance sectors to collectively advance equity, reduce poverty, and improve health in neighborhoods across the United States. I'm also a pediatrician by training and teach as a public health professor at UC Berkeley. Today, I have the honor of serving as the moderator for our discussion. So we're lucky to be joined by leaders in housing and equity research and practice from across the country. So our speakers today are David Williams. He's the Florence and Laura Norman Professor of Public Health and Chair of the Department of Social and Behavioral Sciences at Harvard's T.H. Chan School of Public Health, as well as a Professor of African American Studies and Sociology at Harvard. Second, Megan Haberly is Deputy Director of the Poverty and Race Research Action Council, or PRAC. Third, we've got Kashana Hill, Executive Director of the Louisiana Fair Housing Action Center. And finally, we have Gary Amalia, who's a Senior Program Officer for the Robert Wood Johnson Foundation. So we're going to chat through a link to all of their bios so that you can learn more about them if you like. So in terms of how we use Zoom to run this, to ask a question, we ask that you use the chat box feature. You'll see that on the bottom and at the bottom of your screen. And if you're having technical difficulties, use the raise your hand button, which is also, where is the, oh, I don't see it right now, but at any rate, I just slid over. So raise your hand.
Hey Doug, sorry to interrupt. Are you able to switch back to your computer audio?
Sure. Is it not working?
I think we've lost you.
Oh, huh. Okay, yes, I will switch back. Let's see here.
Just hold tight, everybody. We're fixing this really fast. So Doug will join us back in a minute. And then we will resume our webinar in just a second.
It looks like some people were seeing it.
Hey, Doug, can you talk for me?
Yeah, you can't. So you can't hear me on the phone, huh? The quality's just bad. Can you hear me at all now?
No, can you switch back to your computer audio?
I
think people are saying they can see and hear him fine.
Yeah.
It seems like the folks are hearing just fine, so if you want to go ahead.
Yeah. Yeah. Okay. Now we're not hearing him.
And now you're on mute.
Okay. There we go. How's that?
Yes, great.
Okay. Okay. Apologies, everyone. We're getting, some of us can hear and some can't. So it looks like everyone can hear me all right.
Yeah.
And do chat through if you're having any troubles. With that, we are going to have, the webinar is going to be recorded, which I'm now very excited about. And along with the recording, we're going to send all of you an email with the resources that are mentioned. As a reminder, participant lines are all muted, so do use the chat box. We've also, we'll provide resources into the chat box live. We have a number of resources that will drop in, so keep an eye on the chat box for that. And as you saw, we've already dropped in the backgrounds for the speakers as well as the link to the proposed rule change for the AFFH. You'll also see on the slide our Twitter handle. So we're going to use AFFH, hashtag AFFH webinar today. So if you have anything to add or anything you'd like to point out, do use AFFH webinar, and you can see the links or the handles for our various organizations. And we will chat through those as well so you can get access to them while we're speaking. So with that, and apologize for the delay, I'd like to open the discussion first by turning to you, David. So I'm guessing many of us here on the webinar are familiar with the practice of redlining, which denied loans and mortgage refinancing to designated neighborhoods in the U.S., predominantly African-American or immigrant communities, following the Great Depression. But even though the official practice ended by the 1960s and 70s, policies and practices that foster residential segregation have continued. Can you tell us about some examples in the history of that?
Yes, thank you so much. I would say that residential segregation, which has led to the concentration of where people live based on their race, is as American as apple pie. It was imposed by legislation. It was supported by the major economic institutions in our society. It was enshrined in the housing policies of the federal government. It was enforced by the judicial system as well as vigilant neighborhood organizations. And then it was legitimized by the ideology of white supremacy. So the entire infrastructure and social institutions of American society came together to create it. I want to give a couple examples of how back in the 1930s, Federal Housing Administration, FHA, whose job it was to provide loans and backing for loans so that the average American could own a home. This federal entity established a national appraisal system where race was a major factor in the assessment of real estate and as well as in the assessment of financial risk for investing in real estate. The areas that were all white and far away from minority areas received the highest rating and the color green. So they were areas of low financial risk. And those communities that were all minority or in the process of changing received the lowest risk, the lowest rating, sorry, or the color red. And that's where we get the term redlining from. That is, areas were demarcated and coded as of bad financial risk. So that started in the 1930s. And then in the post-World War II era, federal programs were established to facilitate the development of the suburbs and home ownership, especially for hundreds of thousands of GIs as they returned from the war. Again, the Federal Housing Administration established guidelines that indicated that the presence of one or even two non-white families could undermine real estate values in new suburban communities. These government guidelines were then adopted by the entire real estate industry. I want to give you one example of how this occurred. When the white residents of 8 Mile Road in metropolitan Detroit were told that they were too close to a Black neighborhood to qualify for a positive FHA rating, they built a 6-foot wall, 6-foot high wall between themselves and their Black neighbors. And once the wall went up, the mortgages on the white properties were approved. One statistic that may be relevant here is between 1934 and 1962, the federal government underwrote $120 billion in new housing, and less than 2% of it went to non-whites. So it shows how this system that was put in place that created residential segregation had a huge impact in disenfranchising non-whites in terms of access to the suburbs, access to housing, and so forth. I think it's also important to note when we talk about residential segregation that the government did support housing that was available for Blacks, and that was public housing. It was generally located in central cities, and it concentrated large numbers of poor people of color in one place. My last point on this would be to quote historian John Sell. He wrote a book on the origins of segregation in the US South and South Africa. And he argued that residential segregation by race was one of the single most successful domestic policies of the 20th century in the United States. It's beneath the radar screen, but it has a broad range of pervasive negative effects.
Mm-hmm. Yeah, thank you, David. It's really striking because, as you say, when I first saw, I sort of had learned initially about redlining as sort of generally discriminatory, but when you, as you suggested, when you read the actual details, it's overtly naming negative attributes of neighborhoods as being made up of immigrants or African American or being infiltrated. There's like incredibly racist language that's woven through that I think many of us are not entirely aware of. And the idea of building the wall suggested is such a powerful example of the intentionality of a lot of that work. So in terms of your research, of course, really focuses on connecting the dots between race and health. And so can you provide us some highlights specifically about how housing and residential segregation fit into the link between race and health?
Sure. I first want to illustrate, we understand that race and health, the power of not just racism, but a broad range of social determinants. And basically, residential segregation creates access and denies, for those who are highly segregated, access to economic opportunity in American society. So I want to share with you a few studies that highlights that. David Cutler, an economist, using rigorous statistical methods, using national data for the United States, was able to calculate that if we could completely eliminate segregation, we would erase Black-white differences in income, in education, and in unemployment, and reduce racial differences in single motherhoods by 2/3. All of those differences are driven by access to opportunity at a neighborhood level. Another national study, this one by William Julius Wilson and Robert Sampson, studying the 171 largest cities in the United States, says there's not even one city where whites live under equal conditions to those of Blacks. And they concluded that the worst urban context in which whites reside is considerably better than the average context of Black communities. Again, segregation has created unequal opportunity. And one last national study, if I think of the work of Raj Chetty, he has been studying the intergenerational transfer of economic mobility. So he's looking at Black and white parents at the same level of income and looking to see what are the outcomes of their children. And what he has found is that Blacks have worse outcomes than whites, even when they start out with similar incomes. And the difference for the children of Blacks compared to the children of whites is linked to opportunity at the neighborhood level. In one particular place in one of his papers, he points out that Black boys do well if they are in neighborhoods with good resources. The tragedy is there are few neighborhoods where Black boys live in the United States where they have access to good resources. And all of these inequities matter for health. Research shows that where you live in the United States, for most people, determine where you go to school and the quality of education you receive. It determines access to job opportunities. It determines quality of housing and quality of neighborhood environments, which includes the quality of city services, the quality of neighborhood resources, access to fresh fruits, safe places to exercise, access to nearby nature, the level of exposure to physical, chemical, toxic exposures. So virtually most of the major social drivers of health are patterned at the neighborhood level. And so research documents that segregation is a powerful predictor of variation in mortality and other health outcomes in the United States. I'll give you two examples. Chicago, one of the largest cities in the United States, one of the cities with the highest levels of residential segregation. If you look at life expectancy by census tract in Chicago, the worst off census tract has a 30-year lower life expectancy than the best off census tract. And it's not just Chicago. If you look in New Orleans, there's a 25-year difference in life expectancy from one neighborhood to the other. The good news, research indicates that if we simply change the neighborhood environment of poor families with no health intervention, we can dramatically improve their health. And we have that coming from high quality scientific studies where persons were randomized. So I think that data is very useful in giving us high quality evidence. On the other hand, I think it's important to recognize that it's not a viable policy solution. People should not have to move from their neighborhood to live in a better neighborhood. We need to think of how can we invest the resources to improve quality of life in the places where people already live and already have their social networks so that they can improve their health, but also their access to economic opportunity more broadly.
Yeah, thank you, David. Just a couple things. I really appreciate your pulling things together. I think your comment about we can't move everybody out of low-income neighborhoods. Like, it has to be a both and. We want people to have better access to higher resource neighborhoods, but we can't not also invest in these low-income neighborhoods. And I want to, I noticed and thank the team for putting in the chat box the Opportunity Atlas, which Ross Shetty and his team put together. David alluded to it. It's an amazing resource. You can put in individual addresses or census tracts and stratify by race, by gender, look at where people really are 25, 30 years later. It's an amazing resource. So I definitely suggest looking at that. And one last resource that the team might chat through is the Virginia Commonwealth University created a series of mortality or life expectancy maps. And so actually, if you Google Virginia Commonwealth University life expectancy, it'll pop up. And the Robert Wood Johnson Foundation funded that work. So you can see a number of cities and the incredible disparities across short distances. So thank you very much, David.
Thank you.
So let's turn to Megan Haberly from the Poverty Race Research Action Council, or PRAC, to talk about the AFFH rule, how it helps to address residential segregation, and what HUD is proposing as a change. So Megan, PRAC's work focuses on developing policies that address the historical patterns of racial segregation. What are some examples of today's policies and practice that foster residential segregation that you've seen in your work?
Yeah, so to pick up where Professor Williams left off, you know, as you know, many historians have documented, we have a very severe and deeply embedded history of racial segregation in our country, beginning decades ago with government practices as well as within the private sector. And so in 1968, as part of the Civil Rights Movement, the Fair Housing Act was passed, including anti-discrimination provisions, but also this affirmatively furthering provision. So this is actually not only a regulation, but it's also part of the legislative mandate of the Fair Housing Act. And so this puts a duty on HUD and on recipients of HUD grant funding, actors, governmental actors that are engaged in housing and community development, to take proactive, affirmative steps to further the purposes of the Fair Housing Act. And so that includes addressing racial segregation and the legacies of racial segregation, including these patterns of concentrated poverty and disadvantage, and the lack of opportunity that goes along with that. So as Professor Williams is saying, this includes things like the patterns of where subsidized housing is located, the opportunities that people have to access a range of neighborhoods, and then also the lack of investment that we see in many of those segregated neighborhoods. And so what our organization and a number of other civil rights and fair housing organizations that concentrate on these issues do is focus on a number of policies at various levels of government. And so you still have to this day government policies that continue to perpetuate and exacerbate these issues of racial segregation that we've had in this country for many decades. And so unfortunately, despite the fact that overt discrimination is no longer legal in this country, and we've seen a fair amount of progress to address segregation, segregation remains very deeply embedded, and that's because of policies at the federal level, the state level, and the local level. So for example, you see still to this day quite a bit of local land use policy, including exclusionary zoning and other choices about where housing may be sited, and in the administration of subsidized housing programs. That travels all the way up to the federal level. And so many of our government housing programs are created at the federal level within HUD and other government agencies, including the tax credit program, the voucher program, our public housing, and all of that is administered by state and local entities. And so there are facets of program design within each of those programs that to this day continue to perpetuate racial segregation, but there are concrete steps that many of those actors could be taking to address those kinds of issues. And that's really what the Affirmatively Furthering Rule was designed to do, is to set up a framework and a choice architecture for localities, states, public housing authorities to examine the way that they were administering those programs and start to take concrete affirmative steps to change program design and to address discrimination in order to correct that legacy of segregation that's still so deeply embedded.
Mm-hmm. Yeah, that's really helpful. Let's see, you spoke a bit about what the actual AFFH rule aims to do. Is there more, I'm just looking at our notes here, specifically in terms of, before we turn to Kashana, that we hope it will do, or the changes that you're worried about with the suggested changes?
Sure. So the 2015 rule essentially was the first step that the federal government had taken to actually implement this affirmatively furthering mandate that had been in place since 1968 and was really intended to address those segregated practices. And so what we had seen in those intervening years was the continuing presence of segregation and discrimination in communities throughout the country because of these various practices as well as individual acts of discrimination. And so what the 2015 rule did was put in place a framework that localities, states, and public housing authorities would use to evaluate their practices. And that local advocates like Kashana Hill, who will be speaking after me, could use as a resource their own advocacy. And in addition to that, it included a provision that required HUD to review these assessments of fair housing as they were submitted to the agency, to look at the data, look at the policies, look at that rich documentation that those grant recipients were putting together and ascertain what are the fair housing problems for this particular local government entity and what should they be doing to overcome that. And so you had a system in place where each of those localities, the local advocates, and a reviewer at HUD, with technical expertise, coming in and reviewing this document. We're looking at the data, the policy analysis, and then designated goals and actions that were very specific to that local community. And we're putting in place concrete steps and commitments in order to overcome segregation. So that could be any number of a range of things. And we saw between 2015 and the point when this rule was suspended that localities all throughout the country were in fact taking very concrete steps as they had been intended to do by this rule. What that was in any given place depended on the place. But we were seeing a whole range of meaningful commitments by both localities and public housing authorities. So these were things like reforms to the way the voucher program was being administered by a local PHA to enable families to move to higher opportunity neighborhoods, regional collaborations, which is a really significant issue within housing policy because we have so much fragmentation within metro regions, and that means that often you'll have particular municipalities that are very rich in resources, and then others in the same metro region that are very resource poor. And often it's land use policy and housing policy that enables that kind of resource hoarding and prevents people from moving from area to area. Balance in subsidized housing was another thing, that was very squarely contemplated by this rule and that a number of localities took steps to address. So this would include preservation in areas that are undergoing gentrification and displacement and where we really need affordable housing to be maintained, but it also meant opening up areas that had traditionally been exclusionary and were richer in opportunity and resources, and taking very intentional steps to make sure the subsidized housing was sited in those areas going forward. So there were really a whole range of action steps that were coming out of this process at the point when it was suspended by the current administration.
Yeah, that's great. I really appreciate that. So the ruling was first passed back in the 60s, and then the update was in 2015. And we're going to turn to Kashana in a moment to hear about, to your point, Megan, some specific examples of what cities and states have done. But can you tell us a little bit more about what the specific proposed changes to AFF and how it's different from what the current AFF rule is?
Right. So what was passed in 1968 was the legislation. And so this is a regulation that implements and interprets that legislation. But what is very clear, both within the text of the legislation, the legislative history, and all of the case law that has developed over the years, is that racial justice, social justice as it pertains to other classes that are protected under the Fair Housing Act, including gender, disability, religion, ethnicity, and segregation are very core to the Fair Housing Act and to what it means to further the purposes of the Fair Housing Act. However, this new rulemaking would completely revise the definition of affirmatively furthering fair housing to erase the connection to segregation, to race, to most of the other protected classes. And what it does is sort of gesture at the notion of increasing affordable housing within a specific jurisdiction, but without attending to the dynamics of racial segregation, racial justice, or necessarily what affordable housing might mean to different populations. So it changes the definition of affirmatively furthering fair housing in a way that really disconnects it from fair housing and from civil rights, as that was understood, by Congress in passing the act, by courts throughout the years, by fair housing advocates and experts, et cetera. And in addition to that, it changes the process. And so you no longer have a comprehensive process that's looking at fair housing issues in depth using data, policy analysis, and goal setting in a way that brings in the fair housing community and local experts that are really steeped in these issues and advocate on them in order to drop those concrete commitments. Instead, you no longer have a specific local process that is dedicated to examining fair housing and racial justice, but you have a very kind of cursory look at what steps the jurisdiction might do to boost affordable housing in ways that tend to be very skewed towards local deregulation, which could, of course, have additional consequences, such as removing environmental protections, removing rent control, things that are really important to vulnerable populations and advocates, even folks that don't necessarily work squarely on fair housing issues per se.
Mm-hmm. Yes, it's clearly a really big change. What do you expect sort of broadly to see in terms of the impact it'll have on our ability to tackle equity and to address racial residential segregation?
I think, first of all, the resource that advocates had while this rule was in effect has now been yanked away. And so during the point in time when this rule, the 2015 rule, was being implemented, there is very rich documentation through data and policy analysis of the problems within any particular jurisdiction, housing authority, and region. And so that resource is no longer available to advocates. It also removes the planning mechanism and sort of the choice architecture that was being set up for localities as a resource for them, for local policymakers, within local governments and public housing authorities to use to examine their own policies and kind of have this step-by-step framework where they would look at the data, the policies, and set goals and really commit to these measures to affirmatively further fair housing, and have feedback from somebody at HUD who is able to really, bring sort of a substantive and technical perspective to that document in the course of reviewing it and giving feedback to the locality on their goals. And so you really have kind of lost, that mechanism that was in place to make sure that concrete steps actually were being taken to further fair housing. And I think that, if the history from 1968 to the present shows anything, it's that, just sort of leaving this mandate, sort of floating out there without a clear mechanism that jurisdictions can use as a framework to make sure they're really taking those concrete steps, very little is really going to happen. Very little is really going to occur to change the status quo. This was very deeply embedded by intentional policies, by market forces, and we're seeing those, continue and perpetuate segregation and injustice in so many ways to this day. And so without a real nudge forward from an actor like the federal government, I think we're very likely to see those patterns continue, despite the fact that I think there is widespread recognition of the benefits of diversity, of the benefits of integration. And, I think a lot of local policymakers, do care about taking steps to address those things, but it's challenging without, some help from the federal government on that front.
Yeah, no, that's helpful context, that it really, the problem didn't arise diffusely. It's very specific in terms of its intention in many cases, and so the solution needs to really be equally intentional. So, Kashana, let's turn to you. We've heard David provided an overview of how health and residential segregation have played out. Megan really gave some background on the AFFH. So let's hear from you about, how has your work at the Louisiana Fair Housing Action Center involved the AFFH, and what's the what role have you seen in terms of the connections between segregation, housing, and this rule, and what do you think the impact of this change is going to be?
Thanks, Doug. So the Louisiana Fair Housing Action Center is an organization based in New Orleans, and we work on ending housing discrimination and segregation throughout the state of Louisiana. So we actually had the opportunity to partner with the city of New Orleans and the Housing Authority of New Orleans to create the assessment of fair housing plan that was submitted to HUD in October of 2016. And that plan was required under the 2015 AFFH rule that was promulgated under the Obama administration. So that 2015 rule really required robust public engagement. And as the folks working on fair housing advocacy on the ground, the city of New Orleans and the Housing Authority brought us in to lead the public engagement work. And so we were able to partner with local civil rights groups who otherwise wouldn't have been able to bring their perspective to the table as part of that process. There was really a lot of broad representation in drafting the plan. And in New Orleans, it felt really important for us to have that cross-cutting perspective being offered. You know, we're working with folks here who certainly understand the very clear links between housing segregation and health, right? So we know that many of our tenant families who are renters here in New Orleans have children in the home. There are very high rates of asthma, and we certainly know that substandard housing conditions are leading to high numbers of emergency room visits because of respiratory conditions that children are dealing with. We heard from David about the differences in life expectancy, and here in New Orleans, the census data is very clear that we're dealing with about a 25-year gap between one of the wealthiest communities in New Orleans. There's a neighborhood that at this point is over 90% white, and it has the longest life expectancy in the state of Louisiana at just a little bit over 80 years, whereas a community that is just a little bit over 2 miles away that is predominantly African American has a life expectancy of 54 and a half years. And so we're talking about a 25-year difference in communities that are just about 2 miles apart. And so we were really able to work with the city and the Housing Authority during this process to bring that perspective and to implement the Affirmatively Furthering Fair Housing rule in a way that addressed these ongoing disparities.
Great. Can you give us some specific examples of how you've been using AFFH rule in New Orleans to sort of support your work there?
Absolutely. One example that I can think of involves some ongoing work in a campaign to support the Housing Authority in addressing displacement that African American New Orleanians are experiencing and dealing with post-Hurricane Katrina. So our Housing Authority actually was not required to participate in the assessment of fair housing planning process that we undertook in 2015. The Housing Authority, though, willingly came to the table as a partner, you know, with the understanding that the majority of residents of New Orleans are renters rather than homeowners, and a full 25% of the renters in New Orleans are clients of the Housing Authority. And so the Housing Authority was really very clear in the fact that affirmatively furthering fair housing isn't going to happen without their active participation. So in the aftermath of Hurricane Katrina, African American New Orleanians are facing massive levels of displacement. There used to be several neighborhoods that were adjacent to the Mississippi River, which is on higher ground, that actually were historically African American communities. Post-Hurricane Katrina, people with resources began to move into those communities as they sought land on higher ground that's less likely to flood. So now, not quite yet 15 years out from Hurricane Katrina, there are no longer any majority Black neighborhoods on that high ground adjacent to Hurricane Katrina. All of those communities are now majority white. So African Americans have been pushed off this land that is less likely to flood, and the communities adjacent to the river are now majority white. We know that the Housing Authority here actually owns lands, scatter sites as we call them, on in communities that have gentrified and that are on this higher ground. And so as part of the AFFH process, the Housing Authority really looked at this as a way to combat this tide of displacement, to address and redress the displacement that people have faced. And so many of the policy recommendations that came out of the community-driven assessment of fair housing process, those policy recommendations deal with preventing more displacement and recommending, for instance, that the Housing Authority bring back affordable housing to those communities that experience displacement post-Katrina. There are also some policy recommendations designed to combat the gentrification that is leading to displacement, things like tax freezes, for instance, for longtime homeowners in these gentrifying communities, incentives for landlords in those communities to keep their rents affordable. And so these very clear policy recommendations that have been laid out in the assessment of fair housing document provide the backing for our local elected leaders to move forward with what has been laid out in the plan.
Yeah, that's really helpful. So it provides a foundation for local community to work together. And to Megan's comment, it allows a specificity to focus on neighborhoods together. So what will be the changes you see if the rule change goes through for your work?
Well, I think, again, this idea that we're able to, think creatively, to use resources to help stem the tide of displacement is going to be incredibly important. The public engagement process very clearly has led to a new set of recommendations that otherwise just would not have happened. It's clear, as Megan was mentioning, that many of the proposed changes to the AFFH rule, they're focused on deregulation and changing exclusionary zoning practices. That's certainly important, but based on our experiences and our work here in New Orleans, and I would say the work that fair housing advocates are doing across the country, we know that changing exclusionary zoning practices isn't solely going to address segregation and promote inclusive communities, right? So ending exclusionary zoning practices is one very important tool to have in the toolbox. But for instance, that's not necessarily going to do anything to ensure that housing will be made affordable. And so the new rule as it stands really doesn't do anything to create new housing opportunities for people of color. It doesn't do anything to address discrimination in rental and mortgage lending practices. And then the last thing I want to say about this is that focusing on zoning and ending exclusionary zoning does not mean that when affordable housing projects, for instance, are proposed in well-resourced communities, that those projects will be developed. We know, and those of us who have done this work know that NIMBY, even not in my backyard sentiment, is very real and very strong. There's a very long history of primarily, white neighborhood homeowners opposing any sort of affordable housing development in their communities. And so we don't really have any reassurance that those NIMBY sentiments won't stop affordable housing development if exclusionary zoning is removed.
Mm-hmm. Yeah, no, that makes sense. And I wanted to make a connection you mentioned earlier, which was the higher ground in New Orleans being now settled by higher income people. And that's an interesting example of what's called climate gentrification for those who are unfamiliar with that term. And we're beginning to see that in other places like Miami. And so it's playing out. And so it becomes a specific battle here for New Orleans, where historically African-American neighborhoods were on higher ground. So before we turn to Girdar to sort of hear what can we do about this work, this is all a little depressing. What is there anything that gives you hope, Shauna?
Yeah, thanks, Doug, for that question. I mean, I do want to affirm that it is maybe more than a little depressing. Absolutely. I think from my perspective, it's promising that there has been so much mobilization to the proposed rule. I think it's also promising that there are, communities, Los Angeles, Kansas City, Philadelphia. There are communities that have gone through the assessment of fair housing planning process. And generally speaking, the jurisdictions that completed the assessment of fair housing process pursuant to the 2015 AFFH rule have found and have spoken out and stated that the process was not overly or unduly burdensome. So there really are communities that have solid experience with the 2015 AFFH rule as it stood, and have generally reported positive and helpful experiences and experiences that will address some of the needs of those communities. So those folks are speaking out. That is hopeful, I think, and the number of organizations and individuals mobilizing in response to protecting the rule, I think, is something that should give us all hope.
Mm-hmm. No, I appreciate that. And so thank you for your perspective on what's happening in Louisiana and New Orleans. And it's a good segue to Girdar, who we'd like to give the opportunity to speak a bit from Robert Wood Johnson Foundation's perspective, what can be done about the new rule change proposed.
Great, thanks, Doug. We just heard a really compelling case for how residential segregation affects health equity. How the AFFH rule, which was originally established in 2015, was creating really promising results in communities all across the country at reducing segregation and giving everybody, particularly historically disadvantaged populations, access to opportunity, and then what it really means on the ground in places like New Orleans. So it leaves us with this question of what do we do, particularly as people who care about health, well-being, and health equity. What can we do with this information that we now have? Well, right now, we're in the midst of a 60-day public comment period on the proposed rule that will expire in less than a month on March 16th. What we encourage all the participants to do is to submit formal comments on the rule, to highlight why you see the rule and the changes to the existing rule as a threat to health equity. HUD will have to review and consider every one of the comments before it moves forward with issuing a final rule. So this is really our opportunity to speak individually and collectively. We are sharing the link to the proposed rule change in the chat box. And as I mentioned, all comments must be submitted by March 16th. You might be asking yourself, why is it important to submit comments on a rule that can seem pretty technical, but we've heard about the real world implications it has. I think you should keep in mind a couple of things. The first is that we think it's critically important that HUD sees that health and healthcare organizations see the proposed changes as a threat to health equity. That's one. Two, we know from federal rulemaking that the volume, the quality, and the uniqueness of submitted comments are really important, and they can persuade HUD or any other federal agency to reconsider or revise their rule. And even if they don't, all these comments can help create a really strong record that can be used by advocates and even in courts if this rule were to move forward and potentially be challenged. Third is this notion that housing and civil rights are health issues. We believe that that is a very important concept to perpetuate through this process. Lastly, as we are working together to build a culture of health, this is a really wonderful chance for health and healthcare stakeholders to be allied with civil rights, fair housing, and affordable housing advocates. We need to work together in an ecosystem if we want to see policies move in the direction that we think are best for health equity. So to make it easier for you, the Robert Wood Johnson Foundation has developed a fact sheet and a detailed summary of the rule, its implications for health equity, and even very specific provisions in the rule that we are particularly concerned about. We highly encourage you to use those documents as you develop your own comments for submission. We are sharing a link to the fact sheet, the detailed summary, and our president's public statement on the AFFH rule in the chat box as well.
Super. Thank you, Gura. So we're running a little short on time, but we do want to get to some questions. And fortunately, people have been chatting questions in, people submitted questions. So we have a number that we've pulled up, and there's been a handful of themes. One thing before we even get to that, I just want to point out, and if I can have the team, a couple questions that come up about opportunity zones and how those overlap with some of this. Rather than getting into that here, because that is frankly an entire different conversation, we'll Slack through, we'll Zoom through, chat through some resources that we've developed on opportunity zones, because there's a lot of talk on that. One specific question, which I think is a good one given our audience, is this came from Dara Epstein, the City of Atlanta. What role can health institutions play in outreach to cities to advocate and promote housing policy that overcomes segregation? Any thoughts from our panelists? What's the role of the health institution outreaching to cities to promote housing? Oops, David is on mute. There we go.
Okay. I would say that in many communities, health institutions are a major driver of economic activity. In many communities, health institutions are the largest employer. And I think there's growing recognition on the part of some health institutions that they're responsible not just for the health of the individual patients they treat, but the health of the community. And so that I think if advocates locally can make the case to health institutions of how these things matter for the overall health of the community, and get them to be an ally and a resource for positive changes that would improve the health of the entire population would be a good thing for us to do.
Mm-hmm. Yeah, David, you're sort of building on Gerdar's comment, which is that this is a sort of potentially obscure HUD ruling, housing and urban development ruling, but it can be really powerful to have an entirely different sector weigh in and say, look, this affects us as well.
Yes.
And it's important that housing and urban development hear that.
Yes.
Kashana or Megan, anything else in terms of your perspective from healthcare with their role, or we could hop to the next question too? We're good? Okay. So we had a series of questions actually related to how the rule change would affect specific populations. Rachel Berkowitz at UC Berkeley asked about unhoused individuals. Kimberly Mazek at Catholic Charities asked about how the rule change would affect Indigenous populations. Lorraine Oliver inquired about people of color generally. Any thoughts about the role on specific subpopulations that you're worried about with the rule change?
This is Kashana, and I'll just say very quickly, and I know other folks might have additional perspectives, so I'll try to keep it short. You know, I don't know that the proposed rule as it stands really considers the nuances of, you know, various populations and the experiences that different populations have. There's not really room for that nuanced discussion to consider the ways in which residential segregation and this country's history of racist housing policy really impacts people's lives, unfortunately. And so whereas under the 2015 rule, there is room, and in fact, there's a requirement to bring these various voices and communities to the table, under this proposed rule, there is no room for that engagement. There's no requirement for that engagement. And really the experiences that people are having, whether those experiences will be listened to or included in any sort of plan, is left up to the discretion of the jurisdictions. And I think that, you know, many of us can guess how that will go for groups that are experiencing oppression.
Mm-hmm. Megan, anything you would add?
I think that's exactly right. I think there's a huge contrast between the 2015 rule and this proposed rulemaking. You know, and again, this speaks to the point that race and other protected classes have really been written out of this proposed rule.
Mm-hmm. Yeah, and it sounds like it provides, as we said earlier, a foundation forward, because who the vulnerable population is, or the at-risk population is going to vary from place to place. And so there's a very important local quality to this, and the FFH helps address that. So a question that's come up a couple times is, what's the role of the state? Given some limitations on what the federal government's able to do these days, how can states, have there been examples of states working in this area, or what's the role of the state?
Sure. So first of all, the 2015 rule applied to states, public housing authorities, and localities that are receiving block grant funding, which the technical term for that are entitlement jurisdictions. That obligation technically never went into effect in application to states because the rule is effectively suspended before the analytical tool that applies to states was ever issued. But under the 2015 rule, there would be an assessment of fair housing, an analytical process that a state would go through, similar to what a locality would go through, you know, New Orleans, for example. And so because of the way that housing policy is structured and administered, states do have a very unique role when it comes to addressing segregation and taking steps to overcome it. In particular, because of these issues of regional inequality and resource distribution, municipal fragmentation, et cetera, where a state is very well positioned to overcome many of those regional inequities, and also to take action with regard to more rural areas. So states really have a unique role that isn't contemplated by this new rulemaking. I would note also the state of California has taken the initiative to pass its own affirmatively furthering fair housing legislation. And so it's kind of stepping into that vacuum where the federal government has stepped away in order to put its own obligation on localities to take steps to affirmatively further fair housing. Of course, that doesn't entirely take the place of the federal rule because the federal rule applies to public housing authorities and to federal grant funding. And so you're sort of removing that leverage, but it is possible for a state government to take initiative and step in and play that kind of proactive role when it comes to localities as well as its own housing policies and practices.
Mm-hmm. Yeah, it's really helpful. And I wanted to point out, we got a note from, I think it was Kanika Young, just to follow up to the last question about the role of healthcare is the role of community benefit planning, and that hospitals can use some of their resources related to community benefits to engage around health equity. Before we run out of time, one of the questions we got, this is from Rogian Kajua Smith. In addition to going to the federal websites and providing comments, are there other suggestions? They raised the option, the targeted letters to the editor in key cities, for example. Are there other coordinated strategies or suggestions any of you might have about how else to raise greater attention to the FFH rule change?
Well, this is Kashana. I would certainly add that things like letters to the editor and op-eds, any sort of social media posts, all of that is very important. Anything that really raises the profile of the proposed rule change and provides insight and input that HUD will see becomes part of the record and is incredibly important. There are absolutely advocates in various communities and within different partnerships working together to provide input and comments, in regard to the rule.
Yeah, I would add, I think the direct voice of advocates, I think, is really crucial. The voices of policymakers, I think, are also really important, which is a point I make to any of you who are policymakers, but also, if you have an audience of local policymakers, I think it's worth, nudging them to comment and sort of take action to articulate why they think this rule would be helpful and important to them.
Just one quick thing I would add in the materials that the foundation has shared. One of the things we highlight is that this proposed rule change around AFFH isn't happening in a vacuum. And there are a series of other changes that HUD and other federal agencies are making that change civil rights protections and other anti-discrimination protections. So however people choose to engage, putting these changes in a larger context, we think, is particularly important because this is not happening in isolation.
Absolutely, and to that point, I would add a pretty, easy suggestion for folks is to follow the hashtag Defend Civil Rights on social media, which will provide more insight into some of these proposed changes that Girdar mentioned. And there are many civil rights organizations, including the National Fair Housing Alliance, the NAACP Legal Defense and Education Fund, that are using this hashtag to call attention to these various changes at HUD that really, or the proposed changes at HUD that really could do a lot to roll back civil rights.
Mm-hmm. Well, great. Well, thank you all. And as you say, this is not an isolated issue. There's also the Community Reinvestment Act that drives a lot of resources from for-profit banks in the neighborhoods is also up for review. So I think there's a lot that our listeners can do. So I want to thank first our audience for participating and all the great questions. I'm sorry we didn't get to all of them, but you will be getting a lot of the resources that came up. I want to thank our speakers, David, Megan, Kashana, and Girdar. And please, again, consider submitting formal comments to the rule change. We'll share the link again in the chat box for the HUD federal input opportunity there. And they're due by March 16th. So we've got a little bit of time. And again, they have to review everything. So as Gerda said, the more input, the better, because it just gives a sense of impact and concern on the part of the national community. So thank you all very much. Thanks everyone who joined us today. I appreciate it.
Thank you.